Hello and welcome everyone to the deep dive into the new Blue Shield Medicare PPO plan webinar. We're very grateful that you're here with us today. We're willing or ready to share some information with you. My name is Holly Lopez, and I'm with the Health Service System staff. And we have additional staff members on the line today, ready and listening for questions throughout the time we have together. We also are joined by a health plan representative from Blue Shield of California, who will be joining us and is available for answering questions during our question and answer period. And today we have three portions together. We have a pre-recorded introduction video about open enrollment, and then that will lead into the second portion, which describes the deep dive into the new Blue Shield Medicare PPO plan. And then the final portion is dedicated time for questions and answers, which will all be active in the chat. And I encourage you all, if anyone, to join the chat right now. Make sure you can hear us and that our visuals coming through, our sound is coming through. And I can see that's confirmed, so that's great. I'm going to start our pre-recorded introduction. We'll get started.
Health Service System Open Enrollment Webinar. We're so glad you've joined us today to learn about your benefits for plan year 2025. The open enrollment period is the time each year when all members can enroll in benefits or change their current benefit coverage for the upcoming calendar year. During this period, you can change from one plan to another, waive your coverage, add or remove dependents from coverage, and enroll in flexible spending accounts. If you do nothing, your current benefit elections will roll over to the next plan year. However, flexible spending accounts do not roll over. Eligible members must re-enroll in the flexible spending accounts every year to participate. All new benefit choices are effective January 1st, 2025. Here are some key dates for plan year 2025. Open enrollment starts at 8 a.m. Pacific Time on Monday, September 30th, 2024, and ends at 5 p.m. Pacific Time on Friday, October 25th, 2024. You may enroll through the e-benefits portal on the San Francisco Employee Portal. Paper applications must be postmarked by October 25th, 2024 to be accepted. During the webinar, all attendees will be muted and off camera for the entirety of the presentation. We encourage you to ask questions at any point during these presentations. To ask a question, open a chat box by clicking on the chat icon in your menu bar. You may find the menu bar either at the top or bottom of the screen, depending on whether you are using a computer, a mobile device, or a tablet. We will answer as many questions as time allows during the Q&A portion of the presentation. Important. Please do not share personal medical information in the chat. All chat text is viewable by all attendees, and we recommend a one-on-one consultation if you have specific personal concerns. If you have a question that includes personal or private medical information, please schedule a private one-on-one consultation with our health plan vendors during our open enrollment office hours for SF-HSS members, which can be found at sfhss.org/OE2025. If you have eligibility questions, please call SF-HSS Member Services at area code 628-652-4700 or visit our offices at 1145 Market Street, 3rd floor, during our business hours listed on the screen for further assistance. And lastly, we want to remind everybody to get their annual flu shot and COVID booster to protect yourself and your loved ones during this fall and winter. And with that, our presentation will now begin.
Thank you for joining the SFHSS Blue Shield Medicare PPO webinar. We look forward to help support you and your loved ones when it comes to your health and well-being. In this short presentation, we are going to cover what Blue Shield Medicare is and how it works. We will also share information on transition of care from United Healthcare to Blue Shield of California. Blue Shield Medicare offers comprehensive medical and Part D prescription drug coverage with the freedom and flexibility to access care from in-network and out-of-network providers nationwide. This plan may be a good fit if you like to self-refer to specialists and see both in-network and out-of-network providers. Plan highlights to take note of are no-to-low copayment for most Medicare-covered services, access to virtual health care with Teladoc doctors, and coverage for medical care across the United States, including urgent and emergency care anywhere in the world. Blue Shield Medicare gives you flexibility and choice. You can choose to receive care from Blue Shield Medicare in-network providers. This option allows you to pay your coverage copay, and the provider will bill us directly for covered services. Or, you can choose to receive care from out-of-network providers that participate in Medicare and are willing to treat you. Here are some helpful tips before seeking care from out-of-network providers. Check with your provider before receiving services to confirm that they participate in Medicare. If you receive care from a provider who does not participate in Medicare, you will be responsible for the full cost of the services you receive. You don't need to get a referral or prior authorization when you get care from out-of-network providers. However, before getting services from out-of-network providers, confirm that the services you are getting are covered and are medically necessary. It is best to ask an out-of-network provider to bill the plan first. But if you have already paid for the covered services, we will reimburse you for our share of the cost of covered services. Or if an out-of-network provider sends you a bill that you think we should pay, you can send it to us for payment. As you can see on this chart, your Blue Shield Medicare plan gives you the flexibility and choice to not only see in-network doctors and healthcare providers, but also out-of-network doctors and providers at the same cost share as long as they participate in Medicare and bill Blue Shield of California. There are no deductibles and no-to-low copayments for most covered services. Coverage includes a $0 copayment for routine hearing exams and a $2,500 allowance per ear every 3 years for the purchase of hearing aids. Blue Shield Medicare gives you access to pharmacies that offer preferred cost sharing across the United States. Major pharmacy locations include Albertsons, Costco. A member doesn't need to be a Costco member in order to obtain covered prescriptions here. CVS Pharmacy at Target, Safeway, Vons, and Walmart, where you can receive a 3-month supply for 2 months' worth of copay for most drugs. You may also have your maintenance medication delivered to your home or office at no charge for shipping. Signing up for home delivery pharmacy saves you a copay. Receive a 100-day supply for the cost of a 2-month supply of covered maintenance medication. To find a network pharmacy near you or more information on formularies and home delivery prescriptions, visit our website at blueshieldsca.com/sfhss. Blue Shield Medicare provides coverage for routine acupuncture and chiropractic care at a $15 copay per visit for up to 24 visits per benefit category per calendar year. These are non-Medicare covered services. No need to see your physician of choice for access. You can self-refer to any chiropractor and acupuncturist in the American Specialty Health Plans of California ASH network. To find an acupuncture or chiropractor provider, go to blueshieldca.com/find-a-doctor. For out-of-state acupuncture or chiropractic services, call Blue Shield Medicare's dedicated customer service team for assistance. Your Blue Shield Medicare membership comes with additional benefits: vision coverage, transportation for non-emergency medical appointments, personal emergency response systems that keep you connected to your caregiver network, gym membership with the Silver Sneakers fitness program, and a home meal delivery service to help with your recovery after being discharged from inpatient hospital or skilled nursing facility care. To find out more about the benefits, visit our website at blueshieldsca.com/sfhss. Getting answers to your urgent questions has never been easier. The Blue Shield Medicare SFHSO website gives you 24/7 access to health plan information. With only a few clicks, you can get an overview of your Blue Shield Medicare plan. Find in-network doctors, download plan documents, and get details on some of the benefits like emergency and urgent care around the world, preventive care coverage, 24/7 virtual care with Teladoc, and so much more. To ensure a smooth transition of care, members will have direct access to Blue Shield Medicare's dedicated customer service team to answer any questions members may have regarding the plan. Additionally, the highly skilled Care Navigator team is here to help with scheduling appointments and care coordination. Members receive dedicated support from the pharmacy technicians on any pharmacy or formulary questions. Blue Shield's pharmacy implementation team is working closely with SFHSS and OptumRx to help ensure a seamless transition. To help ensure continuous medication access, existing open refills for home delivery and specialty pharmacies will be transferred with member enrollment. Members will have access to a concierge team with pharmacy benefit specialists to help answer inquiries about the Blue Shield pharmacy benefit and network. And lastly, Blue Shield is disseminating proactive communications with educational materials help facilitate formulary transition and mitigate disruption. In addition to medical and pharmacy benefits, Blue Shield Medicare members have access to behavioral and physical health benefits. Call Blue Shield's highly trained Medicare customer service team to receive help with questions about behavioral health benefits. As mentioned earlier, your Blue Shield Medicare membership comes with the Silver Sneakers benefit, which includes a gym membership, community classes, and online programs to help with your overall well-being. We know you have many choices, and we appreciate you investing this time with us. To learn more about the Blue Shield Medicare plan, visit our website, blueshieldca.com/SFHSS. Thank you.
Thank you, everyone, for listening to that introduction video. I wanted to remind you that the chat is open and several attendees are providing questions now. We have both our HSS, our Health Service System staff available, as well as our health representative from Blue Shield of California. And we've got plenty of time to answer those questions. As the video noted, personal health information is something that's protected. So if there are certain individual experiences or inquiries, we may need to refer you to speak with a one-on-one individual just to protect those health privacy concerns. So let's dive in. I'm going to go through our first question, which is from Wendy. If the retiree is in the middle of a treatment or ongoing medication, how can it be transitioned to the new plan? And I can hand that over to Charles first, and if Olga needed to supplement.
Yeah, I'll go first. So my name is Charles Lee. Thanks everyone for attending. And so we are, as I put in the chat, we're working very closely with United to share data and ensure continuity of care. So that goes with current treatment and current prescriptions as well. However, it is always a good idea to inform your doctors of the change to Blue Shield as well, so that they've got that extra layer of awareness. And if they do need to follow up with us, they will know how to reach out and ensure continuity of care there. And so, like I'm saying, we are making best efforts to ensure on the front end that we've got that taken care of. But it's always good to double check. I tell my parents as well that you always need to communicate with your doctors when you change carriers, and so that they're aware and updated.
Thank you, Charles. The next question is from Linda, and Linda is comparing the exercise options in Marin, currently under United Healthcare Plan, and is wondering about the options with Blue Shield that which are less than the United Healthcare. So, Charles, if you could speak to the healthcare exercise options.
Yes. So with the gym membership, we apologize for the inconvenience. We're always working with Silver Sneakers, and we're providing feedback to them in terms of their network and how to expand, which is their priority. So we're always working with them to do that. We'll keep you posted in terms of additional availabilities moving forward to 2025. But again, we apologize for the inconvenience at this time.
Thanks, Charles.
Hi, and this is Jessica Shee. I just wanted to let our member know that the United renewal also included the same Silver and Fit program. So even if we were still on United, it would still be Silver and Fit. But we believe that Blue Shield will be looking into do their best to try to expand their facilities. Thanks.
Thanks, Jessica. The next question comes from Andy and is asking, if I switch from my current Blue Shield HMO plan to PPO plan, do I have to re-register my primary care doctor again with the change?
So I'll jump in here, Holly, again. For our change to PPOs, typically a PPO plan is more flexible. You don't need the referrals, and you don't need as often the referrals and direction and approvals. So for that flexibility, that includes your primary PCP. You don't need to call us and inform us directly who's your PCP, your main PCP as well. So.
Thanks, Charles, for clarifying about PCP. And I'm wondering, Olga, if you could speak to the plan switching. If our members are going to be automatically enrolled in this PPO, so their information would be transferred as well. Can you speak to that?
Yes, that's correct. Yes, of course.
Okay.
So if you're currently enrolled in the United Healthcare MAPD PPO plan, you will automatically be switched over to the Blue Shield MAPD PPO plan. There's no action that you need to take proactively during this open enrollment to make sure that that switch happens. The only caveat to that is if you yourself are on the non-Medicare plan and you have Medicare dependents, any of the non-Medicare dependents within your home or your non-Medicare individuals within your sphere of who you're providing coverage to may switch from the non-Medicare plans to correlate it to the available non-Medicare plans under Blue Shield. So what I mean by that is that if you have any dependents or if you yourself are currently enrolled in the doctor's EPO plan, the select EPO, or the non-Medicare UHC PPO plan, you can, so you will automatically be switched, or your dependents will automatically be switched to the correlating plans, but you can make changes to that. So for example, if I'm enrolled in the doctor's EPO plan, I will then transition over to the Blue Shield Trio HMO plan. But for example, if I don't, if I want to be in a wider network, or I have other needs, and I see that the Access Plus plan is better suited for me, or the PPO plan is better suited for me, I can take action as long as I'm a non-Medicare recipient of this coverage and switch to one of the other plans. Access Plus and Trio, both HMO plans, are available only in the state of California. If you happen to be a retiree with dependents that's outside the state of California, your plan switching would be a little bit limited. You'd only have access to the PPO plan, so that would be just a direct switch there. But those are the only kind of proactive actions that you may want to take if a different plan suits your family more. But the Medicare individual within your home that's covered by our plans will automatically be transitioned to the Blue Shield MAPD PPO plan, and no action is required on your behalf.
Thank you, Olga. I know that was a second part of that question, but wanted to make sure it was clear. So thank you.
Of course.
The next question comes from Linda, who is asking a little bit more about why the transition from one plan to the next, and that may be more on an HSS response, possibly Jessica. Linda is asking, is there a reason why SFHSS changed from United Healthcare to Blue Shield after decades of coverage?
Yes, thanks, Linda. We actually recently, because of the market conditions, we saw that there was an increase rising costs in healthcare, and we wanted to get in front of it. It is our mission to provide affordable, sustainable coverage for our members, and to make sure that the coverage is for all of our current retirees and our future retirees. So we want to ensure that affordability and high quality coverage is there. So for that reason, our company, our department actually went out and issued a RFP, a request for a proposal. United Healthcare was obviously invited to bid for our business. Blue Shield also bid for our business, and they just came in with a better bid. And you can actually go onto our website, look for the RFP, and you can see the scoring of the results. But I hope that answers your question. Thank you.
Thanks, Jessica. The next question comes from Valerie. How do we know which gyms are in our community are part of the Silver Sneakers? And is there a contact number for specific information?
And so I've got that, Holly. So I put in the chat the specific website to find Silver Sneakers participating gyms as well. And then you can always give us a call at Blue Shield, a call directly too. 800-370-8852. That's 800-370-8852. And you can give us a call for additional information about Silver Sneakers or your benefits, any other benefits, whether it be medical, prescription, etc. Our folks are there 8 to 8, 7 days a week, Pacific time.
Thanks, Charles. And for all those listening, we do appreciate you writing in the chat. We're also verbally saying the questions out loud, so any of our participants can both see and hear the questions and responses that are coming through. So do check the chat for any links, as Charles just mentioned. The next question comes from Esther. Is there a distance limitation on where you can see the specialist you want under the PPO plan?
And so thanks for that question. And the answer is no. So this plan is available nationwide. So even if your specialist is way out there in Texas, as long as they're Medicare participating and bill Blue Shield, your services will be covered. So there is no limitation in terms of a specialist or any other provider. I guess that's what I'm trying to say as well. Any other provider nationwide will be covered. So
Thanks, Charles. The next question comes from Ron. Hi, I'm a Superior Court retiree, and I'm currently enrolled in the United Healthcare plan. Do I need to switch plan to the Blue Shield plan for both healthcare and Medicare? What are my options? So, Olga, I know you touched on this a little bit earlier, but if you wanted to repeat any part of that.
Sure.
Response.
So you will automatically be transitioned from the United Healthcare Medicare Advantage plan to the Blue Shield Medicare Advantage plan. So there's no action that you'll need to take other than that kind of convoluted response that I had if you have any non-Medicare dependents. On the Medicare side, you do not need to make any additional changes to with Social Security regarding your Medicare Part A and B. We will automatically be switching you from the United Healthcare plan to the Blue Shield Medicare Advantage plan.
Thanks, Olga. The next question comes from Twilla. Does the hearing aid benefit cover bilateral hearing aids, one for each ear?
yes, and so that's a great question, and I think that's also a good facet of our plan. You've got $2,500 allowance to use as you need per ear, so up to $5,000 for both ears as you need to. So you can choose a specific, since it's an allowance, it gives you the flexibility to choose whatever models and features that you require for each ear. So.
Thanks, Charles. The next question comes from Diane, who's looking for very specific aqua exercise or Chai Chi in their area and is wondering if their local college pool could be used for the Silver Sneakers benefit.
Yeah, so unfortunately, the Silver Sneakers network is what we need to remain with. And we appreciate the feedback. And as we mentioned before, we're always looking to expand the network. But so you need to give us a call or go on to the Silver Sneakers website. I think it's pretty robust, and you can take a look to see what type of facilities and what type of amenities are available through that website.
Thanks, Charles. The next question comes from Sharon, who is referring back to the presentation about pharmacies and is wondering if Walgreens is covered in the pharmacies.
Yes. So I apologize for leaving out Walgreens, but yes, Walgreens is certainly part of our network. Good news
Great.
there.
Thank you. The next question is from Daniel. I'm a retired member with Medicare and will be on the Blue Shield of California Medicare PPO out of network. And my +1 husband without Medicare will be on the Blue Shield of PPO California out of network. How will our deductibles be applied to us as a mixed status couple? And that may be an Olga question, who knows the details of different members being on different plans.
That is correct. And if you give me just a moment, I want to go ahead and get the question or the answer in writing. It's a little bit more complicated, so
Okay.
I don't confuse folks. So if you give me just a moment, if we move on to the next ones, then I'll get that back to that one. And just
And
before
Holly, in the
sorry, go ahead.
meantime, sorry, Olga. So in the meantime, I just want to clarify for the new Blue Shield plan, there is no deductible for the plan, and so just to be clear, for the as the plan is today too with United, there is no deductible for the Blue Shield or United Medicare Advantage plan. So just to clarify.
Great. Thanks, Charles. And Olga, just let us know when that's available and we'll jump right back and speak out that response. We'll move to the next question, which is from Dwight. I am currently on Blue Shield active duty and will retire at the end of the year. So congratulations. What, if anything, besides updating my billing info on the MyChart app within the Blue Shield platform, do I need to notify my medical team of the transition? And I can read that
Oh,
again.
so Dwight and hi, Dwight. This is Jessica, and thank you so much for your service to our city. If you are about to retire, what you want to do is definitely, and you are just at that range. Hopefully, you've already scheduled time with Spurs. And after you get your packet from Spurs, you'll need to reach out to our member services. As far as your own medical team, it's great that you're already on Blue Shield. The transition for your care should be fairly seamless, but we need to make sure you get on to our retiree benefits. So make sure you set up some time with our member services for a consultation. Olga, did you have anything else to add for Dwight?
Nope, you got it. Thank you, Jessica.
Thanks, Jessica and Olga. And at some point before we end, we'll just make sure that our member services phone number is in the chat. I know we've been speaking it out loud, but we'll put it in there too. The next question is from Valerie. Is there only one Medicare PPO plan with Blue Shield, or are there other choices? This member, Valerie, doesn't have any dependents or spouse on the current United Medicare plan. So the first question is, are there any other options outside of the Medicare PPO plan?
So I'll take that, Holly. So I believe the two options for Medicare retirees that are 65 and above with parts A and B Medicare are Kaiser and Blue Shield's plan in 2025. The good news is both plans are very robust with benefits. It just depends on your needs. Kaiser is a little bit more localized in California, whereas the PPO plan with Blue Shield gives you additional flexibility outside of California. So if you are a snowbird, if you travel to visit relatives and so on, the PPO plan probably gives you better flexibility to do that. So those are two options. Once again, Kaiser and Blue Shield PPO for 2025.
Thanks, Charles. The next question comes from Wincy and is asking for Access Plus Blue Shield HMO. Will the plan cover CPMC, Sutter Health Walnut Creek facilities, and CCHP in San Francisco? So these are the medical facilities. And then there's a follow-up question of will there be access plan for covering fertility treatments?
Holly, unfortunately, I don't have the information on our active plans at the moment, so we'll have to research that and get back to folks. So,
and Wincy, we have a separate active employee medical plan presentation where we do discuss Access Plus. But just to answer your question for Access Plus, HMO, CPMC is in-network. Sutter Health Walnut Creek, I believe, is also in-network, and is CCHP the Chinese hospital? That is, I believe, is also in network. Access Plus has the broader network between Trio and Access, the two HMO plans, and we also have a non-Medicare PPO plan with Blue Shield as well. As far as fertility treatments, all of our plans, our active employee plans, cover fertility treatment at 50%. You'll have to get the process started with your OBGYN.
Thank you, Jessica. And the more information can be found on our website for active members as well. So we can move on to our next question. Mary is asking, what does it mean to have lifetime coverage? And that might be benefit coverage for a member. So I'm not sure if Jessica or Olga could speak to what would it mean to have lifetime coverage?
I'm not sure what that's in reference to in terms of lifetime coverage. Mary, if you can elaborate just a little bit, and we'll make sure that we get to your question.
Thanks. Yep, and the chat is active, so feel free to jump back in there with any specifics, Mary. Thanks. The next question we'll go through, and we're about halfway through our time, so keep those questions coming. Robin asks, am I correct in assuming that there will be no YMC locations covered in the new plan? On the map, there are very few SF locations listed in the new plan within walking distance where Robin lives. So Charles,
Yes,
you can, yeah.
absolutely. And Holly, I sense a little bit of a theme here. And yes, we have notified Silver Sneakers that YMCA is certainly a coveted provider for gym membership and within the city. So they know they have a gap there. And as I shared before, there are efforts underway to close that gap as best as we can. So yes.
Thanks, Charles. Yeah, we can see that trend that our retirees are looking to stay active and well in
Right,
retirement. So thank
absolutely,
you.
and
Yeah.
absolutely, we want to encourage that as much as we can. And Silver Sneakers is well aware of the priority that we have, and with HSS coming on board, so they are very sensitive and working diligently. So we're hoping to continue to have updates for folks. So.
Great, thanks, Matt. Thanks, Charles. The next question comes from Arlene, asking what are the differences between services offered between Blue Shield and UHC that result in the budgetary advantages in HSS? And Charles, you may be interpreting this differently, but I'm wondering if you could speak to the any member-facing budgetary changes, or are they the
Oh,
same?
okay. Oh,
Yeah.
gotcha. So I could probably adjust it or address it in two ways, I guess, or two ways. But certainly to that, the first is member impact. So direct member impact. We worked very diligently with HSS to ensure there is as much coherence or continuity in care and for the benefits and for co-pays and co-insurance, pharmacy, et cetera, et cetera. So there will be no changes, no disruption there. And so that was one of the requirements of bidding on this business with you folks, that there would be minimal disruption. So there is no differences in terms of services. I guess the second question I thought of was in terms of the cost advantage to switch to Blue Shield. I'm not sure if folks are aware, but Blue Shield is a not-for-profit organization versus other organizations that may be for-profit and may have to answer to shareholders. So that, in a sense, allows us additional freedom to invest and be able to prioritize folks in California solely, as opposed to a nationwide company that has a variety of customers nationwide. Our goal is, like I said before, is as a non-profit to focus on Californians for Californians. So we're able to focus our investments, focus our money to prioritize Californians.
Thanks, Charles. And this one, next question comes from Ron and Olga. Could probably answer this one really quick, which is Ron understands that the United Healthcare coverage will auto switch to Blue Shield for both the Medicare. Yeah. I can see you shaking your head. Yes, correct. Okay.
And I could answer the question that it took a minute to get the materials for. So I've added it to the chat around where you would find your deductible for your non-Medicare dependent. I've included the summary of benefits for you, along with our benefits guide for you to be able to identify the deductible amount. Also, as Charles said, just to reiterate, for you as a Medicare retiree, there is no deductible as it's been with the United Healthcare plan.
Thanks, Olga. And the next question comes from Linda, who is reminding us that in retirement, there's some international travel that can happen. And so Linda's wondering what coverage happens if there is an international traveler and they need to find medical care.
Absolutely. So under this plan, urgent and emergency care is fully covered anywhere in the world. So what if you happen to be needing urgent or emergency care, please look for your nearest provider and get that taken care of. You do need to pay first, and then bring that information, bring your bills over when you get home, and we can help you submit that and get reimbursed once you get home. So.
Thanks, Charles. The next question comes from Bond and is asking, does Blue Shield Medicare PPO cover CPMC, Sutter Health, Stanford, and UC hospitals?
Yes, those providers are currently in network for Blue Shield's PPO Medicare plan. But I think this is a good time to also point out, even if those providers or any providers are not technically in network, meaning Blue Shield doesn't have a contract with some of those providers, the services rendered by those out of network providers would still be covered as long as one, they are Medicare participating, and two, if they bill Blue Shield. So as long as they follow those two stipulations, they're Medicare participating and bill Blue Shield. Even out of network providers, out of state or out of network providers non-contracted with Blue Shield, those services will be covered. So that's a great feature of the plan. And also, lastly, the copays is also the same. It's agnostic to whether or not it's in network or out of network. That's another great feature of the plan. So.
Thanks, Charles. The next question comes from Arlene. What is the home delivery RX service that replaces Optum RX? And do we have to proactively enroll in it?
Okay, great question. So home delivery RX is going to be supported by a little company by the name of Amazon. So those folks will take care of the mail order delivery for RX. And so on that RX side, once again, we're working very closely with United and Optum to transition those files and information to us so that there will not be any disruption in service. But it may be a good idea, once again, to talk to your providers. And let's say, for example, you go to a pharmacy as opposed to the mail service, the home delivery service, and give them updated information about the switch to Blue Shield. And from there, they should be able to help you ensure that there's no disruption as well. So it's always good to be double safe on the front end and then the kind of the back end as well. So.
Thanks, Charles. The next question comes from Ari. If I am enrolled dependent at UHC PPO, do I need to do anything to stay within the Blue Shield PPO? And that might be an Olga question.
If you are enrolled as a dependent, you will continue to be enrolled as a dependent switching from United Healthcare to Blue Shield, and no action is required at this time unless you want to and are eligible for a different Blue Shield plan amongst the three that I had mentioned, Access Plus, Trio, both HMOs, and then the non-Medicare Blue Shield PPO plan.
Thanks, Olga. And I'm just seeing that Daniel, who had asked the question about the deductibles, reiterated his question in the chat. And Daniel, there is a link from Olga in the chat to share more resources. We'll move to our next question from Twilla. Will the vision plan remain the same?
Yes, absolutely. The vision plan remains the same. In addition to the Medicare covered services, HSS has a yearly vision exam benefit as well. So that will be available every year as well. So.
Great, thank you so much. And Twilla has another question, and this may be more from the HSS side about our website, finding information, saying that I entered my demographic info on the website to access my plan, and the site says the website is now available. And so it may not be available right now, but if Jessica, if you could just explain where to find the information on our website so everyone knows. Could be for Jessica or Olga.
Yeah, as far as places that where you enter your information, that would probably be our retiree calculator. So I'm not sure which website Willa was referring to. I did respond to her in the chat to get some clarification. But I am happy to share our open enrollment website in the chat right now.
Okay, thanks so much. And that's good clarification about entering demographic information would be associated with the retirement calculator. So thanks, Jessica. And we'll keep going through. Mary, who had asked about questions about lifetime benefits, and shared just a little bit more that the San Francisco Unified School District offers lifetime benefits to members. And I'm not sure if that gives our team enough information. Olga, you may
So
respond. And if,
I
okay,
think I know now. I think we're just probably maybe not using the same language as USD does, but you are eligible for retiree health benefits for the duration of your lifetime if you're eligible for the benefits. So basically, a retiree from the Unified School District would get certified by the benefits department at SFUSD to identify that you are eligible based on their rules for retiree benefits. And so once that certification happens and you also file for retirement, depending if you are with your retirement system, SFUSD I believe is not with SFRS. I think it's PARS and CalPERS depending on your position. So the retirement system may be a bit different. And so once you enroll in retiree health benefits, again depending on kind of the level that you're eligible for, depending and that's going to depend on how many years of service you have, you will continue to be eligible. If there is a premium to those services, again, depending on how many years of service you have, as long as you're continuing to pay that premium, you will continue to have benefits. If it is at a zero premium, you will continue to have those benefits for your lifetime. I believe that's what we're referring to here. And if it's not, please clarify in the chat, and I'll make sure that we get you the correct answer.
Thanks, Mary, for sending a little information, and Olga for following up. There is another question, and Jessica, I know that you had mentioned we have a webinar dedicated to our Blue Shield HMO plans, but let's see here if we can confirm. This member, Wendy, is asking for TRIO in the Access Plus CPMC, the California Pacific Medical Center, is covered. So they're asking, would the CPMC be covered under the Blue Shield HMO plan?
Blue Shield, both Blue Shield Trio and Access Plus has access, or CPMC is in network with both of those HMO plans.
Thanks, Jessica. We'll move to the next question. Irene said, I was told that SmileWay program under the dental care offers up to 4 times the cleaning in a year. Are there any medical condition requirements in order to have the 4 cleanings? If so, do I need to submit a doctor's statement?
So there are specific conditions, and I'll go ahead and put the link from our website along with all of the conditions in the chat.
Great, thanks, Olga. And the next question comes from Saja, who's also wondering about medical coverage when traveling. Are you covered when you travel outside of the country for more than 6 months? So thinking if there's a limitation on
right. So any international travel for urgent or emergency care is covered regardless of the time. So if you're international, urgent, emergency care, those are covered. So the routine services, unfortunately, is not.
Thanks, Charles. The next question comes from Virginia. Is Rite Aid covered for drugs?
Yes, Rite Aid is part of our pharmacy network. So, correct.
Great, thanks. The next question comes from Arlene. If we go to an out-of-network provider, do we have to get Blue Shield approval in advance?
So, Arlene, that's a great question. And so the typical answer is no, because, for example, if you go to see a dermatologist, that's what example that comes up, you can go to that out of network specialist directly. Now, there are some procedures, more complicated procedures, that we do need to work with a PCP to coordinate and make sure it's the correct treatment. But in most cases, for out of network providers and specialists, you don't need to get an approval in advance.
Okay, thanks, Charles. The next question comes from Wendy and is asking about copays. So how much are copays, or if there's a reference to what copays are?
Well, I can answer that, try to answer that. Whatever the copay that you have today will be the copay that you have with Blue Shield. Because as I mentioned earlier, we worked very diligently with HSS to make sure there's minimal disruption in services and cost share and all that disruption. So whatever you're paying, for example, $5 would be the PCP copay, and 15 is a specialist. So those would remain in effect as well next year.
Great, thank you. So the next question comes from Wendy and is asking about transportation for non-emergent services to the health-related location, and saying that the health-related locations may be covered for 24 one-way trips per year, and is wanting to know how does this offering work?
Okay, and I'll put it, I was kind of working through to put it in the chat. We've got a company called Call the Car, and I'll put the information here shortly. What you do is you schedule with them in advance, I believe 24 hours at least, and be able to connect with them and schedule your pickup and drop off. And so it is 24 trips, single one-way trips back in per year. So
Great, thanks for clarifying. And then I can see in the chat, Daniel, you were referencing some of the RX Amazon 30 or 90-day supply. If you could expand on your question just a little, we'll be able to get right back to you if you're still on the call. So thanks. The next question comes from Arlene. Is Amazon setting up a special phone system to handle the Blue Shield RX questions?
yes, there will be information. I believe it's online, and as well, we'll be sending you materials, welcome kit, that you can call Amazon directly as well. So there will be special phone numbers for them. And also at the same time, our member services also has access to all the information Amazon does. So at 800-370-8852, sometimes it's more efficient to contact us directly because we have the information that Amazon does as well. So we can help out.
Great, thanks. And it'd be helpful to drop that number in the chat too when it's live.
Yeah, we'll do.
Okay. The next question comes from Erica. What hospitals are participating in the Blue Shield HMO?
Oh, that's a great question. So what I'm going to do, hopefully, is also, well, once again, 800-370-8852 shares with you the information for our member services, as well as our website. And so at the Blue Shield, I'll put that down as well, blueshieldca.com/SFHSS. We've got additional tools and services to be able to locate providers within California, outside of California as well. And we've also got member materials in terms of the benefits. And lastly, once again, you can always call us directly 8 to 8 Pacific time for any questions one-on-one.
Thanks, Charles. I know we're giving you back-to-back questions, so you can't get into the chat to type all these in, but we appreciate it when you get the moment to do that. Yeah.
Yes.
So the next question comes in from Dwight. In the Alto prescription delivery service, and Dwight dropped in a link, wondering if that Alto prescription delivery service is covered. Dwight uses it currently on the Blue Shield coverage.
I am not sure about that. To be honest, I will have to look that up and double check, Dwight. I apologize for that.
Thanks,
Alto prescription. Okay,
thanks,
I'm
Charles.
making a note. Okay, RX. Okay.
And the next question comes from Peter. My dependent spouse is on Medicare AB and will be enrolled in Blue Shield MA, Medicare Advantage. I am not yet 65, but I am retired. Do I have a choice of the Blue Shield plans?
Yes, that is correct. So, right now, if you were originally enrolled with um, United Healthcare Doctors EPO, you'll be automatically transitioned to the Blue Shield Trio HMO. If you were enrolled with United Healthcare Select EPO, you'll be automatically transitioned to Access Plus HMO with Blue Shield. And then if you were in the United Healthcare non-Medicare PPO, you will be automatically transitioned to the Blue Shield non-Medicare PPO. If you want to make changes to your automatic plan transition and you're eligible for other plans, you can do that during open enrollment. So as the example that I gave earlier, if you're enrolled, if you're transitioning from doctor's plan to Trio and you wish to be in Access Plus or the non-Medicare PPO plan, you can take action during this open enrollment and make changes to be able to enroll in your selected plan, just with the caveat that the HMO plans are in California only.
Thanks so much, Olga. The next question comes in from Arlene. Is there an appeal process if an RX is not in the formulary or is a very high cost category?
Oh, absolutely, absolutely. So we understand that there are exceptions. You know, life isn't going to be black and white. So there absolutely is an exceptions process. So what we typically do is you follow the process and work with your doctor. Your doctor would work with us and see if there are other options available. If not, there is that process for an exceptions request. And so those requests are handled, and we work once again. We work with their doctor to process those requests appropriately.
Thanks so much. We've got about 8 minutes left, and if we go over just a bit, it's fine. We want to make sure that we're getting through these questions and giving you live responses. So I'll keep going through. And just as a note, we are going to have the full recording of the webinar today with our answers and the presentation uploaded onto our website. And that'll be within a day or two to get that up. And from there, you can see a transcript as well. Jessica, is that correct? That timeline and the transcript availability?
Today's webinar will be available next week.
Okay, thank you for clarifying. All right, we'll keep going through.
And Holly, I also wanted to point out that there is another deep dive we'll be doing as well on the 23rd at 11 a.m. So if we need to follow up or you want to follow up with us, we'll be available on the 23rd as well. So there's another
Great.
opportunity. So
Thanks. And Mary has a question, and I'm sure it's a quick response, which is, oh, I just lost it. Oh my goodness. We've got some rolling in questions here. So let me go to the next one and I'll return to that one. The next question we'll go to is Esther. Can you explain how out-of-pocket copays limit work for a family plan for active employees and dependents?
Olga, I'm going to need a little bit of help on the active side.
And
I'm so
again,
sorry. I
yeah,
was looking
yeah.
at the question from Mary. You said it was from Esther. Let me go ahead and just read that 1 second.
Yeah, I'll read it again. And knowing that, our webinar is deep diving into our Medicare PPO plan today, but this question is asking from Esther, can you explain how the out-of-pocket copay limits work for a family plan for an active employee and dependents?
So let me get the links for the summary of benefits for this member, where we'll be able to give the breakdown along with our benefits guide, where you'll be able to see the out-of-pocket costs and copayments for active members. Just give me a moment.
Great, thanks, Olga. I know our website is full of information, and having a quick link can be helpful for anyone listening today. So the next question comes from Bond Yi. If one of my specialists retires in December, how do I ensure my medications will be covered until I get a new doctor, which may be sometime in 2025?
Right, that's a great question. And I think the best way is to make sure that your prescription, for example, is doesn't end 1/1. So let's say, for example, if it's a maintenance medication, if you can make sure that the prescription extends past January of 25, that will automatically also be extended on our end as well. But once again, it always is good to double check. And so if 1/1 occurs, please check in with us and ensure those prescriptions are also in our system. And you can also work, like I said, work with your doctor to make sure the prescription doesn't end on 1/1. It continues on past 1/1, and those extended prescriptions will continue on the Blue Shield side automatically. So.
Thanks, Charles. And we've got several questions coming in about dental benefits. And so one of them is, are the dental benefits linked to the Blue Shield benefit plan? Because in the past, Delta Dental was separate.
No, and I hope I answered a couple of those similar questions around Delta Dental and Smileway. So Smileway is under Delta Dental. Blue Shield is covering your medical services, while our Delta Dental, our Delta Care, and our United Healthcare DHMO Delta Care DHMO, United Healthcare DHMO are available plans for you for dental coverage. Those are separate from your medical coverage, and I'll include the link to all of the dental plans if you, in just a moment. But they are separate from the medical plan for Blue Shield.
Okay, thanks, Olga. And the question I was referring back to is there was someone who was asking if Rite Aid was a pharmacy that was covered. And Charles, yes, you confirmed that earlier, that
Yes, of
Rite Aid
course.
is.
Yep.
Yeah. And we've got a few minutes left. I'm going to scroll through just to get some more of our questions in. Wincy asked, will Sutter Health in Pleasant Hill and Concord be within the network to use for the Blue Shield Access Plus HMO? And then a follow-up question, what's Blue Shield's phone number for a one-on-one appointment? Charles, if you could share some information on those.
The Access Plus, that's on the active side. I do believe we have additional active side webinars as well. And I'm trying to also, hold on for a second. I'm trying to pull up our health plans on the active side. If you go to
It
this
sounds like
website.
our participants are wanting to know as much as they can about Blue Shield, and we may have separate numbers. So Charles, yeah, if you can find those numbers and
Yes, I'm
drop
trying
them in,
to, yeah, I'm trying
we'll
to,
drop them in.
right.
Eh,
Yeah, I'm trying
okay,
to also, yeah, provide a website for our active plans.
okay, great. So the next question is the Blue Shield Silver PPO the same as the Blue Shield Medicare Advantage PPO?
I'm going to go out on a limb, and since I'm not familiar with the Blue Shield Silver PPO, I'm going to say no, because the Blue Shield Medicare Advantage PPO for HSS is very custom. And like I said before, it was designed to mimic and match and minimize disruption from the current United carrier. So.
Thanks for clarifying. And then Olga, I do see that you've jumped into the chat, and just want to make sure that we clarify verbally the it, Smileway's connection to Delta Dental. So what is the Smileway program and how is it connected to Delta Dental?
Correct. So I have the link for our Delta Dental PPO and the Smileway program that's available under Delta Dental PPO, along with the conditions that will expand your annual cleanings, and how the program works. So all of that information is within that link. And again, just to separate out, Blue Shield is for medical, while the plans under Delta Dental PPO, Delta Care DHMO, and United Healthcare DHMO are our dental plans that are available. I'm also putting in a link to the to the OE website, specifically with a screenshot of where to find the dental plans for our active population, just in case if anyone's looking for that. And I'll also include the retiree link as well.
Okay, great. Thanks, Olga. And just so it's clear is that there are medical conditions that Delta Dental, the dental provider, recognizes that gives those treatments. And so I can see how it's confusing with medical and dental benefits.
That's correct. Yes.
Yeah, it's a good to know that they are communicating to each other, both the medical and dental, to offer the program. And I see another question that's come through right at the top of the hour. Valerie asked, what does DHMO mean?
It is a dental HMO. It's a limited network. You're required to have a dentist if you are enrolled in a DHMO plan. And as a primary, and you would be going through your dentist for any sort of referrals that you may need for your dental work.
Great, thanks. And there's a general question that if we want to make changes, when must they be done?
For any changes for plan year 2025, they must be done during open enrollment, which ends on October 25th. So all documents must be submitted by October 25th or postmarked by October 25th, and our online system will be turned off at 5 p.m. on October 25th. If you have a qualifying life event, those are treated a little bit differently. You'll have 30 days from that qualifying life event to submit the request for whatever the eligible change is, but for kind of under this umbrella as we're making changes and as they're related to open enrollment, changes must be made up through open enrollment, which ends on October 25th.
Okay, thank you so much. I know we look forward to this time each year to know what our options are and what's available. There's lots of numbers and references in the chat here. We also provided the web page link where the recording will be posted. The recording will be posted. You can visually hear that on your device. You can opt for putting on transcription. So while you're listening to that, you can see the transcription when you're listening. There's a lot of information in here. Our website provides so much more, and I think people are getting the message that there's so much to get. And we do have one more question, and we can answer it quickly. Yeah, Charles, you see it.
That.
Okay.
Yeah, I see there's a couple questions about meds not in the formulary. So,
yes,
and that's where the exceptions process that I brought up is key for folks to work with their doctor to give us a call. And there is that specific exceptions process so that we can analyze the specific need and provide the feedback as needed. We realize, like I said before, it's not a black and white world out there, and we have the flexibility to address needs as they come up. So please work with your physician, work with us as well. Give us a call. And if you need additional details to provide your doctor on the process, once again, it's 800-370-8852. We're here to make the transition as smooth as possible. And of course, that means drugs as well as medical services. So,
thanks, Charles. And that last website that was dropped into the chat refers to the retiree dental website, and that's where your questions can be answered about the medical conditions that Delta Dental recognizes to give offerings for retirees. So that has a lot of information and a great place to follow up. And one more question came in. We'll take it because we're still live. It's from Helen. Is vision coverage through Blue Shield separate from VSP for our retirees?
Olga, we've got vision coverage on the Blue Shield plan through VSP for that one $15 copay routine eye exam. Is there additional HSS coverage on the vision side? I'm not familiar with that as well.
So the two plans for that we have for VSP are our basic vision plan that is included with your medical, and if you were looking to do kind of buy a program for additional services through a VSP Premier, there is that additional service available there as well. And so all of that can be found again on our website for that distinction. Uh, I don't recall there being a completely separate outside of a VSP vision service under Blue Shield. Is that correct, Charles? That's correct, right?
Correct. And I think that would address Twyla's question here. The Blue Shield plan covers eye exams, $15 copay per year, but unfortunately, there is no hardware allowance. It's just the eye exam. So.
Okay. Thank you, Olga and Charles, for making sure we can share those offerings. And we are just about to close. I'm seeing just a few more coming in. Thank you, Olga, for dropping in the VSP benefits for our retirees. And anyone, our website is always live to be able to share what currently is available in the plan that you're in through December 31st, 2024. We've been talking about what will happen in 2025. And for Olga or Charles, if there's anything else to offer right here at the end, I know we've had some last minute questions come in, but it seems like we've gotten to all of them.
Right. I think one question is the current UHC plan is the same as the future BSE plan. They're both PPOs. So once again, we want to minimize disruption, give you freedom, etc. And so they're the same plan.
Great. Thank you. And Jay has just dropped into the chat that we'll have this same webinar will be offered again later this month before open enrollment closes. So if you have any questions that come up, please do so. All right. Well, thank you all for staying on, and to our health plan representative Charles for joining us today, and our HSS staff. We are here on our webinars being able to answer live, and please go back through the chat and get on our website to answer any other questions. Really appreciate you joining us today and staying on with us. So with that, take care and be well.
Thanks, everyone.